You know, every newborn has this feature that's both totally fascinating and, for a lot of new parents, kind of nerve-wracking: the soft spot on their head. So in this explainer, we're going to dive right in and uncover what it is, why it's there, and how it's actually one of nature's most brilliant designs.
I mean, if you've ever gently touched the top of a baby's head, you've probably felt it. That soft, delicate area where sometimes you can even feel a gentle little pulse. It's wild. So what exactly is that? And why in the world is it there? Well, let's find out. All right, so first things first. Why does this soft spot even exist? It turns out it's not some random quirk of evolution. It's actually a truly brilliant piece of biological engineering. The official scientific name for this soft spot is a fontanelle, and it's really just a gap between the bony plates of a baby's skull, all covered by a surprisingly tough membrane. So far from being a weak spot, these gaps are absolutely essential. These gaps have two incredible jobs. First, during birth, they let the skull bones kind of squish and overlap. This is what helps the baby's head navigate the narrow birth canal. It's genius. And second, they provide the space for the brain to grow at an incredible rate. I mean, it nearly doubles in size during that first year alone. All that growth needs somewhere to go. But here's the thing, these gaps aren't permanent. They have a job to do, and once that job is done, they close up. And they do it on a pretty predictable timeline, a schedule that doctors really rely on. A baby actually has several fontanelles, but there are two main ones we focus on. There's the posterior fontanelle, which is smaller and at the back of the head. That's the first one to go. But the one most people are familiar with is the anterior fontanelle, right at the top and front. It's the largest one, and it's the one doctors pay the closest attention to during checkups.
So that smaller one at the back, the posterior one, it's usually the first to close up, typically around 2 to 3 months old. The main event, though, is the closure of that big anterior fontanelle at the front. This usually happens between 12 and 18 months, though it's perfectly normal for it to take up to 2 years sometimes.
Now, this predictable timeline isn't just a fun fact. It's a vital diagnostic tool. You can think of the fontanelle as a little window that gives doctors a quick glimpse into a baby's overall health.
Yeah, just by gently feeling the fontanelle, a pediatrician can gather some really important clues about what's going on inside. It's a super simple, non-invasive check that can signal if something needs a closer look.
So what are they looking for? Well, a couple of key signs. A sunken fontanelle can be an indicator of dehydration. On the flip side, a fontanelle that's consistently bulging or feels tense can be a sign of increased intracranial pressure. That's just pressure inside the skull, which could point to an issue like an infection. And it's not just about pressure. The timing of the closure itself really matters. If a fontanelle closes way too early or way too late, that can be a clue for doctors to check for other underlying conditions. This is exactly why it's something they monitor at every single routine baby checkup. Okay, so that was a lot of info. What are the most important things to take away from all this? Let's do a quick recap. All right, let's sum it all up. 1. Fontanelles are those gaps we call soft spots. 2. They exist for two really smart reasons: to help with birth and to allow for all that massive brain growth. 3. They close up on a pretty predictable schedule, usually by 18 months. And 4, and this is the big one, until they close, they serve as this invaluable health indicator for doctors. Simple, but so important.
When you think about it, the fontanelle is a perfect example of a temporary feature that has a huge lifelong impact. It really makes you wonder, doesn't it? What other incredible designs of early human development are just hiding out there in plain sight?